Hi everybody, my name is Stephanie. I'm going to talk to you today about cystic fibrosis. I apologize for my voice because I have the flu. So I'll talk a little bit about cystic fibrosis and then I'll go into my case study. It's nice to talk to you a little bit about cystic fibrosis because I do see a lot of these kids where I work and take care of them, and I don't think a lot of people know much about cystic fibrosis, so I'm happy to share this with you. So cystic fibrosis is an inherited autosomal recessive disease. The CF gene has been located on chromosome 7. CF is a result of a defective epithelial chloride ion transport mechanism. When you have this mutation, your CFTR, or your cystic fibrosis transmembrane conductive regulator gene, causes the CFTR protein to become dysfunctional. When the protein isn't functioning correctly, it's unable to move chloride to a cell surface. And without chloride to attract water to the cell surface, then the mucus in various organs becomes sticky and thick. In the lungs, when this mucus collects, it clogs airways, and it's called mucus plugging. It traps bacteria, it causes frequent infections and inflammation, and eventually respiratory failure. In the pancreas, the buildup of this mucus prevents the release of digestive enzymes that help the body to absorb necessary nutrients, and this can result in malnutrition and poor growth. In the liver, this mucus can back up and cause liver disease. So symptoms of CF include chronic cough, frequent respiratory infections, oftentimes wheezing, shortness of breath. There's poor growth and weight gain, and there's frequent greasy, oily stools. And in the long term, it does cause infertility in men. So diagnosing CF. So usually CF is discovered on a newborn screen. This is a state mandatory test, and there's a marker for CF on it as well as other kinds of diseases. But so often the CF is discovered on a newborn screen. It is followed by a sweat chloride test, and then usually genetic screenings are done as well as carrier screens. Most CFers are diagnosed by the age of 2. And according to Cystic Fibrosis News Today, the life expectancy for these patients is approximately 37.5 years old. There are over 30,000 individuals living with CF in the United States currently. So maybe a little more prevalent than some of us knew. My case study is about a 14-year-old Caucasian female. She's admitted for CF exacerbation. She has no significant past medical history other than her CF diagnosis and a tonsillectomy at age of 4. This is the patient's first CF admission, which is pretty remarkable. She's followed in the specialty clinics by a team of doctors and a pulmonologist. After her most recent visit to the clinic, her PFTs were found to be 74, which is significantly below her baseline of high 80s. She's also currently experiencing symptoms of a URI. Her weight is down approximately 4 pounds, and her doctors have decided to admit her to the hospital for 2 weeks of IV antibiotics. On assessment, this patient is petite, pale, and thin. Her vital signs include a temperature of 99.1, blood pressure of 117/74, a pulse of 96, respiratory rate of 24, and an oxygen saturation of 92% on room air. She has nasal congestion, a persistent productive cough with audible wheezes, and rails bilaterally. And she's noted to have mild clumping of her fingernails on assessment. Otherwise her assessment is benign. She is reporting that she's having an increased number of loose stools, but she also admits not being compliant with her enzymes. Diagnostic tests performed for this patient include a chest x-ray. Did show some opacities, but no consolidation, and is not concerning for pneumonia at this time. Blood work was done, and it came back within normal limits other than an elevated white blood cell count of 16,000. She also had a sputum culture done. Did come back positive for Staph aureus, which she has grown in the past, as well as Pseudomonas aeruginosa. Treatment for this patient includes nutrition therapy. So she is put on a high protein, high calorie diet, which she probably was on at home, but a calorie count is initiated. She will also receive daily fluid boluses, IV antibiotics, including tobramycin, ceftazidime, and vancomycin. And then RT will be heavily involved in this patient's care with treatments like chest physiotherapy, vest treatments, use of bronchodilators, hypertonic saline nebulizing treatments, Dornase alpha. She'll also be receiving pancreatic enzymes with all meals, and then daily vitamins. So nursing considerations for this patient, and just CF patients in general. You know, the big thing for these patients is keeping them on a scheduled routine. Talking to the patient and the families about what the plan of care involves, what time medications are due, what time therapies are due. Compliance is key. Antibiotics need to be given at their specific order times in order for blood levels to be consistent and in a therapeutic range, so time is of the essence. Nutrition is also a big component of treatment, so encouraging these patients to eat, making sure they have snacks available that are calorie dense is gonna help these patients, and then helping them find a way to keep track of what they're eating. So just giving them the tools to keep track of that. So writing it down in a notebook, on a board in the room, or whatever's gonna work best for the patient. And then lastly, maintaining PPE for the nurse and the patient. These patients are very susceptible to picking up bugs due to their immunocompromised state. So always wearing gown, gloves, mask is going to be important, so that you don't give the patient something new and they don't give you something that you could take to someone else. CF patients are always required to wear a mask when they come out of their room. And I guess this could vary depending on the facility, but so wearing that mask when they're out of the room is important. They also need to know that if another CF patient is on the unit, that they're required to stay 5 feet apart from that other patient to prevent them from sharing organisms. And then with all that said, you want to make sure these kids don't feel alienated. So you want to encourage them to come out of their rooms, walk around, participate in activities that are going on, provide crafts and activities. Is going to be beneficial for their mental health, which is also important. So for my particular patient, her PFTs improved. She was able to gain 2 pounds of weight, and she was discharged at the end of her 2-week inpatient stay. Thanks for listening.